How can a blood pressure medication decrease ADHD? So you asked for it and I will deliver the good, the bad, and the sleepy of Guanfacine. So Guanfacine is a non-stimulant ADHD medication, and it was first used to treat blood pressure, and then something kind of weird happened. So the original research on this took place at Yale, and how do you know? Oh, don't worry, they will tell you. And like most good drug stories, it was discovered mostly by accident. So researchers at Yale were looking at cognitive enhancement in monkeys. So they're looking to see what things can we do to make these monkeys remember information better. And one day they gave them clonidine, which is a medication that is very sedating. But they found that the monkeys, although they were very tired, were still actually pretty good at the task that they gave to them. The actual phrase they used in the study was they were almost asleep and performed near perfectly. So the researchers were like, okay, that's weird. They're sleepy, but remembering things decently well. So how do we make this better? How do we take away some of the sleepiness and increase some of the memory aspects of things? To figure out what was causing that kind of increase in memory and attention, they broke down the drug into kind of its individual constituents. So they're like, okay, what is happening here? What are the specific receptors and neurotransmitters that this drug is working on that helps with its attention? And they found that these were the adrenergic receptors. Specifically the alpha-2A adrenergic receptors in the prefrontal cortex, if you're that curious. Now, the prefrontal cortex has been an area that is implicated in ADHD. So problems with the prefrontal cortex are implicated in problems with things like attention. And if we actually kind of repair those issues in the PFC, that might help with things like increasing focus and attention. And they found that this was how clonidine was working in terms of increasing things like memory and attention. But it still had that problem in that it made the monkey sleepy. So the researchers at Yale were also like, okay, we have clonidine. We know that there's this other drug, Guanfacine, that works similarly but produces less sleepiness. So maybe this could work to improve memory and attention too. And shockingly, it did. It was doing exactly what they wanted it to do, and thus, voila, Guanfacine was born as a potential treatment for ADHD. Now, what does this have to do with blood pressure? So Guanfacine was originally something that we just used to lower blood pressure because it works decently well on that. And it turns out that it is because of a similar mechanism. So what we see is the adrenergic receptors are implicated in things like the memory and attention effects, but you also see that the adrenergic receptors will do something like decrease norepinephrine downstream, and that decrease in norepinephrine after a few more steps decreases blood pressure. Don't ask me about what those steps are. I study the brain, not the entire rest of the body. So it lowers blood pressure and helps with ADHD. And we see, according to like randomized controlled trials and some of the best research out there, that it does seem to work at least decently well. Maybe not as well as the stimulants, but definitely decently well. We do, however, see that it has some problematic side effects. So shockingly, it makes people sleepy, as discussed with monkeys, does the same things to humans, although not potentially as bad as some of the other drugs out there. And it does have some common side effects like abdominal problems. So you basically have abdominal pain. And it takes a while for it to start working. So similar to some of the other non-stimulants like atomoxetine, kind of has to build up in your system a bit for it to start working. It also has problems with when you should take it. So it should not be taken in combination with high-fat meal because that actually increases absorption. And so it can cause this like substantial dip in your blood pressure. And its effects on blood pressure can actually make it more difficult to quit too, because then during withdrawal, you have the opposite effects of the drug. And so your blood pressure will like spike. And this is yet another medication that should not be taken with grapefruit. Now, as a reminder, grapefruit works on the same enzymes that some of these medications do. So what happens is that if you take grapefruit, it can actually increase the dosage of the medication that you're getting. And again, cause that like really low dip in blood pressure that can be very problematic for people. There are also suggestions that it might increase things like psychosis and hallucinations in kids, but these are pretty much case reports. So yes, there have been case reports of children who take Guanfacine and then all of a sudden they think that their room is like covered in frogs, literally a case study out there. But those are just case reports. We don't have like large scale studies on this that say that, yeah, that is a big problem. Now, they are trying to develop new ways of kind of using this. So they previously had the immediate release tab, and that's kind of been just like taken out of the equation. Pretty much all that's out there right now is the extended release tablet, but they are attempting to develop things like patches, which they say work for like 3 days. Those of you who have ADHD, tell me if you think that putting on a new patch every 3 days is going to be easier for you to remember than taking a drug once a day. Now, can guanfacine work for other things? There are a lot of off-label uses that have been suggested for it. So the first one was anxiety, and that was something that I was kind of curious about because we do see that like blood pressure medication can reduce anxiety. Now, I learned this in a very bad way because I take propranolol, which is a beta blocker, so that reduces blood pressure. I take that for my migraines. And then, like the great drug scientist that I am, I thought I had reordered it, but it turns out that I didn't. So I was without propranolol for a few days. And let me tell you, my anxiety symptoms were genuinely horrific. Like, I felt that anxiety because it seems to be linked to the physiological anxieties. And weirdly, this might be true for dogs too. So I am a dog adoption coordinator, and one of the dogs that is available for adoption has high blood pressure. And she was like super shy when we first got her. Sheba is her name. And then we started giving her high blood pressure medication, and she became so much less shy. Like, she became like kind of outgoing almost overnight. There might be something there with blood pressure with dogs too. So yeah, there have been studies that suggest that it might be good with anxiety. It might also be good with things like PTSD because it is reducing some of that hyperarousal that your body is feeling, so similar to symptoms of anxiety. It's also been used off-label for things like tic disorders and Tourette's. But the thing is that it seems to work for those if you have ADHD as well, not for people who just have like a chronic tic disorder. Now, because it is relatively safe and relatively effective for things like ADHD, we're trying it for all sorts of other things too. Like maybe it'll help with things like quitting drugs because it can actually better help with like control and prevent things like relapse. People suggest that it might be good for things like oppositional behavior in children, especially if they have ADHD as well. And it has been suggested as a kind of treatment for insomnia too. Now, it failed miserably there. Like, overall, it actually seemed to decrease your sleep. And somebody tried to use it for nightmares, but it turns out that it was just decreasing nightmares by decreasing REM. And so, yeah, you had fewer nightmares because you weren't dreaming as much, because you weren't in REM as much. And REM is like a thing that we actually want. That's what helps with things like memory consolidation and healing. So yes, it could work for things like ADHD as well as a variety of other disorders, but we're still in early stages here. And you always got to decide if those risks and side effects are worth it for you, especially in comparison to other drugs.